Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of January 18th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are, so we are here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 67,000 COVID cases and 764 COVID deaths. As you can see here, COVID daily cases remain high. There may be a slight indication that it is coming down slightly. More cases continue to come in, but overall, COVID cases remain high. Even more concerning, hospitalizations from COVID remain high. We are currently at 446 COVID hospitalizations, and as you can see here, we have been hovering around the mid-400s for a while now, since the end of 2020, with no indication of this letting up just yet. And again, this is about double what we saw during our summertime peak. And when we look at case rates for the county, so remember that is cases per 100,000 residents, so that we're comparing apples to apples. And we look across all the cities and the unincorporated areas in Alameda County. What we're actually seeing now is that number one in terms of case rate is the Ashland-Cherryland area, followed by Hayward, followed by Oakland. But when we drill down into the zip codes with the highest case rates and positivity rates, those continue to be in East Oakland, and those are our zip codes of 94603 and 94621. And as you can see here, the case rate for these two zip codes is more than double that of the county. The county is a little over 4,000 cases per 100,000, and 94603 and 94621 are over 10,000 cases per 100,000. So we continue to see a disproportionate impact in our East Oakland zip codes. Today, we are going to talk about an important tool in the pandemic, and that is vaccines. For more information on how the mRNA vaccines work, as well as a review on how it was developed rather quickly, please check out our briefing from December 29, 2020. Today, I'm going to talk about the vaccine and why it's so important that we very carefully consider the decision before us now that the vaccine is rolling out in our area. My hope is that everyone will take this decision very seriously and make the decision based on facts and not on emotions or incorrect information or rumors or lies. And I'm going to break this up into two main parts. And the first is our individual consideration. So should I personally take this vaccine? And the second is community or population considerations, which has to do with when can we go back to some semblance of normal. It's important to recognize that these are actually two separate but related considerations, and they should both be important to all of us given the current emergency. First, let's start with what we know about COVID-19 based on what we are seeing here in the United States. And here in the United States, we have arguably one of the best healthcare delivery systems in the world, and yet we have almost 400,000 deaths in the United States from COVID-19. And we have about 24 million cases. And so from that, here is what we are seeing. Of all the people who get COVID-19, about 1 in 10 get severe symptoms. About 1 in 20 get critically ill and have to go to the hospital. And about 1 in 60 will die. And beyond all of that, some percentage of people, and we don't know what percentage this is, get long COVID or symptoms that last for months and perhaps will be chronic. Now, a 1 in 60 chance of dying, I got to tell you, I am not liking that number at all. and a 1 in 20 chance of getting very sick, being critically ill, and having to go to the hospital, I don't like that number either. And remember, this is not limited only to people that have not gotten COVID yet. We have seen people get COVID a second time, and it's not uncommon for them to get sicker the second time. So we can't say I had COVID before, I can't get it again, or I had COVID before and I did fine. There's really no guarantees here. So essentially, right now, we're talking about everyone. So what are the benefits of the vaccine? We've all heard that the two vaccines that are approved right now, the mRNA vaccines, are 95% effective. We know that that's the case for the 2 months of the clinical trials and that it is persisting for several months after, and we will be keeping an eye on all the data coming in so we can determine just how long this protection lasts. But what I think is the most remarkable thing about the vaccine is that it is nearly 100% effective at preventing death from COVID-19 and at preventing very severe illness that might take you to the ICU. So even if you're part of that 5% that gets COVID, even though they've gotten vaccinated, the risk of actually dying or getting very, very severe illness with COVID-19 is almost eliminated. That really takes the edge off of the concerns around the risk of getting COVID-19. So what about the risk of getting the vaccine? So far, the safety profiles on the two mRNA vaccines that are out really do look quite impressive. Don't forget that there were large-scale trials that included a diverse group of race, ethnicity, and age groups, as well as conditions like high blood pressure, diabetes, and obesity. And the safety was excellent across all of these groups in the trials. And it did not vary across those different groups in the trials. That was a milestone that had to be reached in order to get the emergency use authorization. Now, what about after it was approved? And this is something that we're keeping a close eye on as it is being now administered to millions and millions of people. And the most concerning thing that we've seen so far is still extremely rare, and that is the anaphylaxis or serious allergic reaction. And based on what we've seen in the early part of the vaccine rollout is that the risk seems to be less than 1 in 100,000 people getting the vaccine. And it's happening in people with a history of anaphylaxis or severe allergic reactions. There have not been any deaths reported from this allergic reaction. It's treatable, and now everyone is on the lookout for it. So when you get your vaccine, the medical professionals will be prepared. Many people with a history of these reactions are choosing to get the vaccine and nothing is happening. And for some, again, maybe that 1 in 100,000 or less is getting a treatable allergic reaction. So why is this happening? What's going on? One of the questions we've gotten a lot is what are the ingredients? So the active ingredient in both of the approved vaccines is mRNA. The other ingredients are common inactive ingredients found in many medications and vaccines. So before I get to the ingredients, let me tell you what the vaccines do not contain. The mRNA vaccines do not contain MRC5 or any fetal tissue. They also do not contain any COVID-19. The COVID-19 virus is actually not used in the production of the mRNA vaccines at all. These vaccines do not contain eggs, gelatin, latex, preservatives, or meat or animal products. Now, what do the vaccines contain? Here are the vaccine ingredients for each of the mRNA vaccines. Again, the active ingredient is the mRNA. Both vaccines also do contain polyethylene glycol, or PEG. PEG is actually a really common ingredient. It's a key ingredient in some laxatives and in the oral bowel preparation that you take before a colonoscopy procedure. It's an inactive ingredient in many medications and vaccines. And so we think that most people with a PEG allergy would absolutely know it by now. If you have a history of an immediate allergic reaction to PEG or its relative polysorbate, you cannot receive this vaccine. So another question we've gotten is, can I get the vaccine if I have a history of anaphylaxis or a severe allergy to something else? So maybe you have a penicillin allergy, a shellfish allergy, a nut allergy, or your doctor has prescribed you an EpiPen in the past. Can you get the vaccine? The answer is yes, but you will need to stay close by for 30 minutes, so please plan accordingly. The normal observation period after the vaccine is 15 minutes, but if you have a history of severe allergies or anaphylaxis, you'll need to hang out for 30 minutes for observation after you receive the vaccine. And the medical staff will be on standby with the appropriate medications just in case. Now, who cannot get the vaccine? Well, again, you cannot get the vaccine if you have a history of an immediate allergic reaction to PEG or polysorbate or any of the components of the mRNA vaccine. Also, if you've received monoclonal antibody or convalescent plasma as part of COVID-19 treatment in the last 90 days, you will need to wait. So you'll need to wait 90 days for monoclonal antibody or convalescent plasma treatment before getting the vaccine. Now, what about side effects? A lot of people are concerned about side effects. I actually don't really like to call these side effects because these are actually expected results after getting the vaccine that may last for 1 to 2 days, because the immune system is actually designed to mount a response when you receive the vaccine, and that is what your body is doing when it is producing the antibodies. And so here's what we saw in the trials for the 2 vaccines. And as you can see, you've got a little more of one side effect with one and a little more of another with the other vaccine. It's really not enough to make a big difference between the 2 vaccines. With both, you're going to have some redness, some soreness and achiness, maybe some fever. These are all expected reactions that let you know that the immune system is working. It's building up those antibodies that are needed to fight the infection. And these symptoms typically last 1 to 2 days if you get them at all. It does appear to be a little more pronounced after the second dose. So this is something to bear in mind as you think about scheduling getting your vaccine. Again, it's expected that you may have these reactions. Not everyone does, but please do plan accordingly. Another question we've gotten is, who all has gotten this vaccine? Now, over 12 million people in the United States alone have received the first dose of the 2 approved mRNA vaccines. We've all seen lots of prominent people on TV, famous people like Dr. Fauci and Kamala Harris receiving one of their vaccine doses. And for now, we are getting the exact same vaccine in our community, that same vaccine that's preventing death from COVID and preventing 95% of infections for at least several months, probably much longer. We'll know more with time. Soon there will be other vaccines out, and some of them will be much cheaper and much easier to store. They won't have the cold chain storage requirements, and as a result, these may be the ones that become more accessible to us as time goes on. But for now, we will all have access to the same ones, the mRNA vaccines, the Pfizer and the Moderna. Now, will we continue to have access to these? That I do not know, but for now, we will all have access to the same ones, the mRNA vaccines. Now, what about special populations or subpopulations that were not studied extensively enough in the trials? And this is a great question we're getting a lot. Now, it's just a matter of time before we have sufficient data on these groups. Before now, we don't have enough vaccine data on children, the immunocompromised, and women who are pregnant or breastfeeding. It's important to know that pediatric studies of the vaccine are ongoing, and soon we will have more data on the vaccines in children. Also, active surveillance is continuing. So post-authorization studies of safety and effectiveness are ongoing. This is something that we're keeping a close eye on. Also, there is a global pregnancy registry that is under development. And so this is something important that we'll be taking a look at, because there are many pregnant women who are choosing to get the vaccine because they feel that the benefits do outweigh the risks. And so we will be getting more and more data on all of these subpopulations as time goes on. So far, the safety profile continues to look absolutely excellent. And what I think we all want to know and what we are keeping an eye on are a few things. One, how long does this protection last? Is it going to be a year? Is it 2 years? Will we need boosters? These are things we'll be keeping an eye on. Can you still get COVID after getting the vaccine and then transmit it to someone else? Well, this is also something that we are keeping a close eye on. We're really trying to learn more about asymptomatic transmission. But at this time, we know that the vaccine is preventing death and severe illness, as well as any type of COVID with symptoms, and that is preventing it 95% of the time. And lastly, I think we all want to know, how is the ongoing surveillance going for the very rare events like those 1 in a million events, as well as for the subpopulations I mentioned before. And all of that information is coming in all the time. So the bottom line here is that if you get COVID, the risk of dying is 1 in 60. I really don't like those odds at all. Can't tell who's going to be the 1 and who's going to be the 59. It's just not predictable, unfortunately. The risk of getting very sick and having to go to the hospital is about 1 in 20. That's really not a good number. And again, I don't know if you're going to be one of the 1 or you're going to be the 19, but either way, I'm just not crazy about those odds at all. The vaccine so far look quite safe with a very, very low incidence of an adverse reaction. The main one being a potential allergy. Maybe 1 in 100,000 people will get a more severe anaphylactic reaction or allergic reaction, which is treatable, which no one has died from, and which everyone now is on high alert for. And regarding side effects, again, these are really expected effects that last 1 to 2 days, if at all. And most significant and reassuring is that the vaccine is nearly 100% effective at preventing death and very severe illness from COVID-19. It's protecting you from getting infected about 95% of the time, but even if you're part of that 5% who is unlucky and gets it anyway, it will be much less severe and deadly. That is major. Now, if you make a decision not to get the vaccine right now, of course, that is an individual decision. And we just want that decision to be based on facts, or perhaps some specific data you're wanting to see, perhaps because you're in one of those subpopulations I mentioned earlier. And this is a conversation to have with your medical provider. We don't want your decision to be based on some sensational headline or what someone other than your medical provider told you, or based on emotions. And certainly any decision you have does not need to be a final decision. Keep gathering the facts you need until you can make your best and most informed decision. I think it's important that we hold ourselves and one another accountable on this. Do your process to make your own decision. But if you're not a doctor or a medical provider, you should not be giving medical advice to discourage others. How will you feel if that person takes your advice and then suffers or even dies from COVID-19? Please encourage people to talk to their own medical provider for advice, especially if they're in doubt. Everyone should have all the information they need about their own risk as it relates to COVID-19 and their own individual considerations as it relates to the vaccine. We are all having to make decisions in an imperfect situation. This has been the case for the entire pandemic. Of course, I would love 5 years worth of data, but we are just not in that situation right now. Once you're presented with the vaccine, you will have a decision to make. It doesn't have to be set in stone. It's a decision that can be changed, but it is one that we believe needs to be weighed out very seriously. And we should all do our part to stop the spread of misinformation about the vaccine and about everything related to this pandemic, because as we know, we are also suffering with an infodemic or an information overload. Now, let's talk about community considerations or population considerations. This has to do with the question of when can we get back to some semblance of how things were pre-COVID? When can this virus stop spreading like wildfire and threatening to overwhelm our hospital system? And the best analogy I've got to help explain this is actually about a wildfire. So imagine a street or a cul-de-sac with 9 or 10 houses and a wildfire is heading their way. Now, if none of these homes are fireproofed and the wildfire comes, all the houses are burning down. Now, if one of the houses gets fireproofed and the wildfire comes, then that house will stay standing, but the rest of the neighborhood will burn down. Now, if 8 out of the 10 houses got fireproofed, then when the wildfire comes, it would have a very hard time affecting any of the houses in that neighborhood because it can't easily skip from one house to the next. So the 8 that are fireproofed protect the 1 or 2 that are not. And that is essentially what we are looking at with the vaccine. When about 80% of the population is protected, it stops that rampant spread. So who is in that 20% who are relying on the other percent? Well, right now that might include those groups I mentioned earlier where we're still gathering more data. So for example, this may include children and those who are immunocompromised. They would essentially be relying upon the other 80% of us to get vaccinated to protect us all. Now, could it still spread? Yes, but it would be greatly reduced. And it is that at that point when many aspects of our pre-COVID lives could resume. If all goes well, we could be looking at this happening towards the end of 2021. Until then, we've got to stick with the basics. Whether you get the vaccine or not, you are still going to be needing to exercise caution as an individual until we can get to that population level protection. So shelter indoors as much as you can, whenever you can, but only with members of your household. Household does not refer to other family members who don't live with you, or your boyfriend or your girlfriend, or your neighbors, or people in your apartment building. It is really your household. Don't share your air. Mask up, space out. Always protect your elders and those with underlying conditions. And that means by wearing a mask, spacing out, and perhaps by getting vaccinated to prevent spreading to them. If you think you're exposed, don't go to work, don't gather. Isolate yourself, get tested in 5 to 8 days. If you have symptoms, get tested right away. Continue to isolate yourself until you get your results. Take a multivitamin supplement and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.